Hey everybody, running through a quick overview of Wisconsin Medicare supplements today. We're pretty unique. We're the only state that does Medicare supplements in this manner. 47 states do them a certain way, 3 opted out, but we're the only one that chose to do them this way. My name's Mike Lovell. I've been an independent agent specializing in the Medicare market, licensed for over 10 years. So we're running through this today to help give you a little bit more info so you can make your decision on Medicare. One of the first things to note, here's a little clip from Wisconsin Guide to Medicare, and this is referring to Medicare supplements if you see that red arrow on the bottom left-hand side. So Medicare supplement insurance companies can only sell standardized Medicare supplement policies. Each standardized Medicare supplement policy must offer the same basic benefits no matter which insurance company sells it. So cost is going to be the major difference among Medicare supplement policies sold by different insurance companies. That's key. So all these policies are standardized. It's truly an apples to apples comparison, but some companies charge quite a bit more for those same apples. So how do we actually do supplements here? We have a base policy, and then we add riders to it. So riders are additional coverage typically for an additional premium to make the plan more comprehensive. Now there's one of those that actually lowers your premium, but I'll go into that here in a little bit. So going into more detail on what these are, the first one is the Part A deductible. This covers you if you were to go into the hospital, so that the insurance company is going to pay your Medicare Part A deductible, which is $1,408, which you could actually end up paying multiple times per year because it's only good for that 60-day window. So if you have this rider, the insurance company is going to pay that. You don't have to worry about it. Next rider option, this is an either or to the first one, is 50% of that Part A deductible. This means that basically, if you do have that deductible, you have to meet it, you're splitting it. So you're going to pay half, and the insurance company is going to pay half. It's not quite as expensive as the first option, but the first option is a lot more popular as far as the people that I've been working with. Medicare Part B excess charges. This is where a doctor could potentially accept Medicare, but not Medicare assignment. What that really means is that they're going to accept and bill Medicare, but reserve the right to charge you an extra 15% on top of the bill. So if you add this rider, you don't have to worry about that. The insurance company's going to pay that extra 15% for you, so you won't be charged anything extra out of your own pocket. Additional home health visits. The base policy includes 40 visits per year. This rider adds up to an additional 365 visits per calendar year. So it's a nice one that adds on to most plans. Actually, every policy I've ever had has that included. Foreign travel emergency. This is going to pay for emergency coverage outside of the United States up to $50,000. So the way it works is you have to pay the first $250, that's the deductible, and then they'll pay 80% of the bill up to that maximum amount. Now, for anyone starting Medicare in 2020 or later, there's been some rule changes where you cannot get the Medicare Part B deductible. What that is the basically outpatient kind of stuff, Medicare Part B. Past supplements, people could have gotten that rider where the insurance company is going to pay that for you. Due to a law change called MACRA, you're not able to get that. So this is only for people who've started Medicare before 2020. Otherwise, the Medicare copay rider is still an either or as far as you can't have both of these. And it's been a popular one because it actually reduces your premium in exchange for taking on some copays. So what it is that copayment one, after that deductible is met, then this policy will kick in and pay 20%, pick up which is the normal, like any other policy would, with the exception that you have up to a $20 copay for a doctor office visit and up to a $50 copay for an emergency room visit. Otherwise, it's going to pay 100% as far as helping fill in the gaps of Medicare compared to a normal, more comprehensive supplement. So this is the more comprehensive plan option as far as the riders and what a ballpark premium would look like for a competitive rate from a solid A-rated company. So the plan's going to pay that Part A deductible. It's also going to pay those Part B excess charges, the additional home health care visits, and foreign travel. You're going to pay the monthly premium. A going rate is $140 to $150 a month for this plan. And then you'd have the Part B deductible, and that's for a 65-year-old, by the way, those rates. It can vary by gender and age, as well as tobacco use. Give me a call, because there's more than 30 companies that offer these plans. I can get you basically rates for as many companies as you want. That way you can make a transparent decision. You also have the Medicare Part B deductible. After that, this plan is going to help fill in the gaps and be as comprehensive coverage as you can have. The other option is the Copay Plan. This one's still going to pay the Part B or Part A deductible, and then Part B excess charges, additional home health care, and foreign travel. The difference is we added the rider for the Part B copayment. So this actually reduces your premium. So you can see monthly premium drops to about $100 a month on ballpark. So you can save about $50 a month. You still have that Part B deductible, $198. After that deductible, $20 for a doctor visit, $50 for the emergency room. But a savings of about $50 a month adds up to about $600 a year. So you say, well, am I going to spend that much in these copays? Is it worth paying the copay out of pocket for that potential savings? For some people it is, others it's not, but it's been a very popular option for people I've been working with. I said all the companies are standardized, and some of the changes as far as pricing. Here's a look at a quote I ran for someone else. Truly, this is the more comprehensive one. The lowest price plan was $120. The highest price plan was $211. So almost double the premium for the exact same coverage. Truly apples to apples, no difference in doctors, hospitals, the way claims are paid, all identical standardized coverage. This was another option just to kind of give you a little bit more info as far as a quote I ran for someone for the Copay Plan, where you have that $20 copay after that deductible and $50 for emergency room. See, lowest premium $87, high premium $162. Again, almost double. So depending on what you're looking for, you could save a lot of money or end up spending quite a bit more money for the exact same thing. All Medicare supplements guaranteed renewable. You can keep them as long as you want, as long as you keep paying the premium. The premium can change, but not the benefits. Common question I get is pre-existing conditions, especially people starting Medicare. Their insurance companies are required to waive any waiting periods for pre-existing conditions if you buy a Medicare supplement during the open enrollment period, which is when you're first starting Medicare, and you've had creditable coverage for at least 6 months. Also, if you're switching from one Medicare supplement to another, they're also required to waive any pre-existing waiting periods. So if they accept you, they're going to cover you from day one of your effective date. When can I buy a Medicare supplement policy? Well, first one is when you're first starting Medicare. You have a 6-month window. It's called your open enrollment period, and there is no underwriting questions whatsoever. So no premium increases, no health questions, doesn't matter. Your health history whatsoever. After that 6-month period is up, in most cases, you're going to have to pass an underwriting review. Now, if you have a Medicare supplement, you want to change to a different one, change any time of the year as long as you can pass that underwriting review. But if you chose a Medicare Advantage, then typically you can only make that change to a supplement during the annual enrollment period, which is October 15th to December 7th, and at which point you still have to pass that underwriting review. Common questions for me is, how do I get paid? Why am I doing this? I do not charge a fee, so I don't charge you anything for my services or my time. The insurance company you choose does pay me a commission, but the company sets the price you pay. So whether you use me as your agent, or you sign up directly online or you call someone in the company, the price you pay, the benefits that you get for the actual plan are going to be the same. So my services, expertise, 10 years experience, free to you. Or you can go out on your own, pay the same thing, and basically deal with someone in a 1-800 number, which is what you get for working with me. I work for you, not an insurance company. I'm independent. I don't represent just one company. I work with a bunch, but I work for you. I do not, all the companies pay about the same, so I don't have an incentive financially to sell one company over the other or just push one company like certain agents. But I do have an incentive to work with companies who take care of their customers, keep the prices low, have a competitive intro rate, have good service, both for you and for me, because that way you're not spending your time worrying about insurance, pulling your hair out. Like I said, you do not pay extra for me. The premium that you pay is the exact same, and you get to call me with questions. Something comes up, claims issue, I've had people call me, and I've gotten it resolved within about 15 minutes versus calling someone sitting who knows where in a 1-800 call center that you've never talked to before. Also, I can help you shop now as you're going through this period, as well as in the future. Most people have more than one plan during their Medicare time on Medicare. So it's not just a pick one and stick with it forever. You could do that. Most people don't. So I'll help you shop not only now, but also help you shop in the future. So again, my name, Mike Lovell, phone number 608-571-4461. Been licensed in Wisconsin for more than 10 years. I live in the Madison area, but I help people all over the state of Wisconsin. So if you have questions, give me a call, shoot me a text, email me, Mike@askmedicaremike.com. Thank you.